physical question now. What does all the incisions like post-surgery? So when a person wakes up, there's a number of questions here. What are the incisions like? And what will one feel like when they wake up? Because one of the questions I had, will I have to learn to breathe again? Well, obviously, no, I don't. But it was one of the questions I'm a nurse and I was running through my head, will I have to learn to breathe again? So from your perspective, what does one look like when they wake up from surgery, and what will it feel like?
Oh, the incision, it's not a huge incision, not a big incision. It's maybe a little bit more than a thyroid incision if you are used in seeing people they take out the thyroid. So it's just an incision, is a U-shaped incision in the neck, but at the end, after weeks or months, it has almost nothing of the incision in the most of the patient, almost every patient. About the breathing, how to learn to breathe, I think that after the operation, all patients say they breathe better than before, because when you arrive to the indication of a total laryngectomy, in most of the case, you have not a good breathing before the surgery. So the first thing is that you breathe better than before without effort than before the surgery. The second is that is very natural, the breathing. I mean, you don't have to adapt your chest to a new kind of breathing. It's quite easier than before. In the most of the patient, the first feeling is that the breathing is easier than before because you have less resistance than before. In fact, what we do in the postoperative rehabilitation is to use some filters, so-called HME, heat and moisture exchanger, that, like yours, yes, that helps in heat and humidificate the air, but also in create a sort of resistance that is the only thing missing after total laryngectomy. And the resistance is important to have a very wide pulmonary expansion during the inspiration.
I absolutely agree with you on that comment, that resistance is, to me, as important as humidification. Because when I breathe without my HME in, there's no resistance. And it doesn't feel right. It feels very strange. Very, very strange. But when I put the HME in, I feel the muscles working and it feels more normal. So, and I think that's as important as humidification for my lung health, my muscle tone in my lungs. So,
Yeah.
so that's really, really good. So, let's go. I'm finding this conversation absolutely enlightening, even for me after 9 years. It's really good.